Now on Working Capital. As healthcare reform winds its way through Washington, we dig deep into how startups are putting data to work, lowering your costs, and creating opportunity for investors. What happens when you sleep? Probably more than you think. We look at a mattress that helps you get a solid 8 hours of rest and possibly prevent future health problems.
Is anything bad going to happen?
And what am I thinking? Well, check out this futuristic headset. It takes us inside the human brain to help doctors diagnose disease and customize treatment. You're watching Working Capital. We unlock conversations that become trends, and it all starts right now. Welcome to our studios here atop Innovation Alley on the west side of New York. Hey, Hendrick, great to see you.
Good to see you.
Alexandra?
Hi.
Olivier?
Hi.
So there are really three issues that I want us to try to focus on here today. Number one, high cost structures, how do we lower them? Number two, what is it about this patient-centric focus that seems to have come up organically over the past several years? And then finally, how do we bridge the gap, or should I say align patients and providers? So, Hendrick, you run a venture capital firm.
Yes,
that's really your focus. You also came out of Stanford.
I had 3 degrees there because I couldn't choose.
You got 3 degrees?
Yeah, so I did
I knew you were smart.
I did philosophy, I did engineering, and then I did a master's in management.
All right, Alexandra, you're actually an operator. You are a co-founder of a company that makes sensors that go into mattresses to collect data to help us figure out how to sleep better.
Correct. We are 4 founders of this crazy company that decided that beds are obsolete. The way we sleep, we don't know anything about it, we don't track our health, and there are so many more implications that are yet to be discovered, so we decided to create a device that would seamlessly integrate onto your bed.
Olivier, you were formerly with the World Economic Forum.
Yes,
you were the
absolutely.
healthcare strategist.
Yes.
You now run a company that actually tracks our brainwaves. How do you do it?
We manufacture these devices that are totally portable and that allow to record your brain activity.
This is like Back to the Future.
No, this is the present.
Or is it Minority Report? I don't know which.
No. It looks like science fiction, but it's
Right.
actually neuroscience in action. It allows to control things, to measure your brain waves
Right.
when you sleep, when you pay attention to things, and to better understand how we function. And it has tremendous implication, healthcare delivery, for example.
Yeah. So let's just start with this notion of patient-centric care. And since you are looking at patients when they sleep at night, Alexandra, can you talk to us a little bit about that? What exactly is patient-centric care and where did it come from?
I think it comes from the fact that there are more companies like our company or others that are very customer driven and we sell directly to consumers, that we've been able to design the technology based on what the consumer actually wants to use. So instead of creating these like crazy healthcare devices that years ago there would be sleep devices you would like wear on your head or you would have to wrap on around your wrist, which are obstructive, right? Like you don't want to use that while you're sleeping.
Right.
Now companies are developing things that people actually could sleep on in our specific case.
Thinking about data, like if you're getting data, Olivier, coming out of somebody's brain, I mean, what do you do with it?
As Alexandra said, we're talking about people who are not only patients, they are consumers. And it's very important.
I mean, in other words, we don't need to
understand-
be sick to use this stuff.
It's the same person that would buy a soda and would need some medical treatment the same day. And we need to understand better the way they function. When you look at healthcare today, there is this big spectrum. On one end, you've got precision medicine. You've got genomics. It's incredible what we can achieve. But when it comes to understanding the behavior of a patient, it's like performing brain surgery with a butcher knife. It's medieval.
So, Hendrick, you, venture capitalist investor, does this ring true to you?
No, most definitely. I think the most important part of healthcare going forward is actually patient behavior. So like you say, how people
You're the second
think.
person to say behavior.
Yeah.
You said it too.
Yeah.
It's all about behavior.
It is.
But why?
Because you can develop the best treatment in the world. If the person decides not to follow the treatment, not to comply with the treatment, then it's useless.
All right, I interrupted you, Hendrick. So.
No. I think what he said was completely correct. So we focus a lot on people in the U.S. 65 and older who are eligible for Medicare. That is the part of the market that I think that's going to be growing the fastest because it's the most expensive part of the population.
And you know you get paid. The government's going to make sure you get paid, right?
The government
so
makes sure
that's
you get
appealing.
paid. It is appealing, but at the same time, it's also a problem that we need to solve. It's become 18% of our GDP, right? And even if the policy problems were solved, it's still growing very fast all around the world, not just in the U.S. So we think behavior is a huge part of healthcare because out of the Medicare population, around 20% of them have diabetes. diabetes is not about getting one surgery or taking one drug. It's about day in, day out, making sure that the patient continue to take their medicine, continue to make lifestyle changes. It's a 20 and 30-year process where you have to maintain a patient's health.
All right, so here's what I want to know. How can I use these new structures, maybe yours, so that I never get diabetes in the first place?
Now, what we look at in our specific case for the company, because our user base is in their early 30s, is that kind of millennial, still very young population that is interested in preventing. So they want to track their sleep, not because maybe they're having sleep problems, but because they know that in 20 years from now, their sleep's going to look different, and they want to know what is changing and how can they prevent it. How can they keep sleeping great throughout their whole life?
Do you have that much faith in people in their 20s and 30s?
I think that we're using technology differently. We're actually, we're empowering people to own their own health data and say, hey, I'm actually going to prevent everything. We saw our parents or our grandparents age in certain ways and maybe go through certain diseases, and we don't want that.
You just said something very interesting, and that is we own the data. And Olivier, you come from the World Economic Forum, where there's a global perspective. Who owns data? Is it the person, the provider?
Think about a watch that would track your steps.
Okay.
Who owns the data about your step? Generally, the people who manufacture
Like Apple.
the watch. That can be Apple. And the question is, what do you do with it? How can you use this in order to improve your understanding of how people make decisions? Back to the behavior point, when you look at the expenses in healthcare in the US, we're talking about almost $3 trillion a year. And there is an incredible figure about that. 13% of this amount is basically wasted because of behavioral issues.
13% of the $3 trillion that we spend in the United States is wasted?
Is wasted for behavioral reasons. People not complying to a treatment, people not coming to the appointment that they set.
So since you guys are data people, what evidence do you have that the population actually wants to do something about that?
I'll give you a very easy and solid example. If someone's aging and they start losing their eyesight a little bit, they might think, okay, I'm just getting old, I'm just losing my eyesight. In many cases, actually, that's a red alert. If you have any diabetic symptoms, you should immediately go to the hospital and get your doctor to look at it, because it could be complication with diabetes that's turning you blind. But they actually don't know that's what's causing it. So we have a large percentage, like you say, wasted, in that all they had to do was have a doctor look at their eyes and say, actually, that's not just getting old. You need to change your medication. Your medication is not working. And it also just means that when they give you the medicine, you take it.
Or in the case of Alexandra, just get in bed, right? Right? Because the sensors are in there.
Yes.
Right.
I want to drill down a little bit about how this works. You get into bed, there's sensors in there, they pick up what exactly, and then what do you do with that data?
So for the sleeper, right, the person sleeping on this bed, you just lay down on it. It's under your bed sheets. You're not going to feel anything different from what you would
like
in
a
a
mattress
regular
pad.
bed. It's just like a mattress pad, exactly. And we display this information to you, so you actually see when you got in bed, when you fell asleep, when you woke up, got out of bed, heart rate, respiratory rate, which are indicators for the sleep phases you're going through. The only thing we don't have is brain waves, which a sleep clinic would have.
So you could partner.
So yeah,
We're
essentially
we're
people
doing
could sleep at
transactions
those.
here on working capital. That's why we call it that. Is it a good investment?
Our mattress for
I know
the
your
consumer,
money's in it, but should I invest in it?
Yes.
Here's your venture capitalist
yes,
right
it's
here.
a huge market. So
Make-
specifically for us, we're
Make
in
the pitch to Hendrick.
No, we're at the intersection of two markets. So it's almost like a new industry, because we are in the bedding market and the IoT market, which are 96 billion and 22 billion markets, right? And so we're sitting right in the middle, because our device is not only a healthcare device, it's tracking all of this information, which the consumer can use, and then we can use, right, to identify patterns and bigger, we see how much people in the US sleep for, and in different states and different genders. So it becomes very interesting, but also—
But does it become profitable?
That's still a key point, right? I think still for any company that's tracking data, it's pretty delicate to understand the power of what you have.
All right, so I want to, Olivier, understand what this thing does that goes on top of my head.
This way. So,
Is anything bad going to happen?
well, it depends. Did you do bad things before you came?
You'll be
You're
able
reading
to
my
see
brain.
that.
I don't know
Yeah.
what we're going to find out.
So, interestingly, we're recording the electric activity of your brain. There are different brain waves, and we're able to monitor how various parts of your brain networks are communicating with each other. We can track neuromarkers of certain brain disorders. We can track your attention. I can actually
Am I
distinguish—
listening to you right now?
Exactly. No, listen, if I base my judgment of whether you're interested in what I say or not just by the way you look at me. You could be thinking about something else. However, we can distinguish watching from paying attention, which from a consumer industry point of view is gold, but from a patient point
It's
of
a little
view
scary.
is also. Well, it depends. It always depends on how you use the data. And in the case of EMOTIV, we've got more than 75,000 people that own one of our devices in 120 countries.
Wait, how many people own this thing?
75,000.
And so I load it up, I walk around, I wear it, and then what? Does it give me an app readout on my phone?
Yes, it's on your phone.
I can understand why a curious person might want to know some of the information, but could this actually be used to find out, for example, if there were a tumor?
We might be able to see some consequences of a tumor if they are expressed in a motor way. But as such, this is not the kind of device. You would need a scanner, brain scanner, big brain scanner that costs millions.
I feel like we're just now creating these things that can gather data, but have we gotten to the point now where we're interpreting the data, where we're putting it to work, where we're saving lives, where we're lowering costs?
Something that we do specifically with sleep data is we understand that we may not know yet what's in sleep data because there's no one that owns the amount of sleep data that we're gathering. We've gathered over 10 million hours of it, and there's no database like it in the world. So we're just starting the path, and then eventually, maybe after a couple of years, we'll know. But what we do with it is we actually start adapting your environment based on your sleep data. So the environment is the biggest impact on how you sleep. The temperature in your bedroom, in your bed, the comfort of your bed, the light and the noise in your room. So what we do with this device is it's tracking all this info, but also in real time it can adjust your environment to make sure that it's not getting too hot or too cold in your room, and so that will disrupt your sleep. If you fall asleep, your TV can be turned off. So that's a first step that we're taking with the data, to be proactive with it instead of just being a passive device.
Hendrick, does this resonate with you as a venture capital investor?
Most definitely. I think in the end, an investor's job and an operator's job is to really have empathy. And this is empathy, well, not only toward your own investors.
It's the softer side of capitalism.
Exactly, because you need to understand, I like your question a lot because you're asking, do the patients or do the customers really want this, right? And it's really understanding what drives behavior. At the end of the day, of course, a company, to your point, has to make profit. But at the core of it, if the entrepreneurs and also their investors and the people around them are not empathetic, they're building things that people do not need, and you do not understand what's driving behavior, the company will fail.
All right, a lot more to come. When we're back, we're going to blow the lid off healthcare costs. We got to get them down, number one. Number two, we got to bring doctors and patients closer together. We'll be right back.
Inflection Point gives you exclusive, honest access to the founders and innovators that are trying to tackle the social and environmental challenges of our time. I follow these leaders through a pivotal event in their company's quest to reach a new level. We are there for the pitch, the competition, the product test, the lunch, all of the major moments that can determine the future of a company. You were in the room with me. As the host, my job is to take you on this journey and introduce you to these founders. I'll provide the context you need to understand the issues they are working to solve, and I'll be there with you when all the chips are down. The issues that these innovators are taking on are enormous, with local and global impact. But they all have one thing in common. They are trying to change their communities and the world for better. This is what happens when a good idea and a great team reach an inflection point.
Welcome back. You're watching Working Capital. I'm Adam Johnson. Guys, we've talked about sort of the gee whiz stuff that enables us to collect data, but I want to drill down and try to figure out the cost side of the equation, the profitability, a little bit more the investment angle. So how is it specifically, and I think I'll start with you, Alexandra, that we can use data coming out of somebody's mattress to actually lower healthcare costs in some capacity?
Well, it can be used to prevent diseases, right, illnesses. So the data specifically when you're sleeping, you're getting the data from your body at rest, which means you can see stress levels, arrhythmia, other heart problems, sleep apnea, insomnia, epilepsy attacks.
You can actually diagnose this?
You could, yes. We don't do it yet because we're not yet an FDA-approved device, but you can. In our data, you can already see it.
Are you moving that direction?
We are. And then eventually, because we can recognize all those patterns, then you can start capitalizing on it and first sharing it to the user, because for us, like we were talking about, the social aspect of it is
Right.
about being very responsible. And in the end, the person that bought our device is the one that should be granted access to their data first.
That's an interesting point, by the way, this whole kind of peer pressure thing that gets to the behavioral issues that you've all been talking about, right? If you share data and say, I got a really good night's sleep, or I didn't, and here's what I'm doing about it, it plays on that peer pressure.
Yeah, well, you see all the paradoxes on social media. People wouldn't share their blood type with a database that is owned by the government, but they would put pictures of themselves in all sorts of situations that are very personal. And whether we like it or not, this is the way people function, and we need to understand better what are the incentives for people to share the data with databases that are owned by the payers.
So Alexandra, just to close the loop on what you said, if I use your device and I discover I have arrhythmia, sleep apnea, et cetera, one of these conditions, then what do I do, and how does that in theory lower my healthcare bill?
Well, you can take that to your doctor. So instead of waiting 10 years for maybe you've been having this arrhythmia for how long, you may detect it early. So you can take those early steps to preventing from something degenerating later on.
It's about lowering long-term care costs.
Yes.
But it won't necessarily change my monthly $500, $600 amount that I pay
Not
right
yet.
now.
Not yet. There are insurance companies already looking at how can they use your data. If you're a person that's taking care of yourself, there are many insurance companies providing
Yeah.
fitness trackers,
And-
right?
and I'll get a
plus,
discount.
Plus, it's going to
Yes.
help you live longer. So that's, for the same price, I'm happy to live longer.
See, here's one of the things that I wrestle with. On the one hand, you've got patients who want to be healthy, right? And hospitals who, I hate to say it, but maybe they want patients to get sick, because when patients come in for treatment, that's when they get paid.
That's the problem with the payment system. We're functioning on a fee-to-service, is that you're rewarded as a provider. The more you deliver, the more money you make. And this is how it's got to change.
It's a disaster.
Listen, the 13% waste I mentioned was about behavioral factors. Overall, globally, it's a third of healthcare
30%.
expenses that are wasted because the system is not designed to be optimal.
All right, so let me ask you this, and feel free to weigh in, because you're in the insurance business, Hendrick.
Yes.
How is it that you reward monetarily a doctor for not treating a patient?
I think a word you'll be hearing about a lot, I think, in the near future, is a term called capitation, which you probably know about, which means that
Capitation.
capitation. It sounds like a scary term, but really all it means is that you basically say, okay, we're going to pay insurance firm $10,000 a year to take care of this patient. So do whatever you can to make sure that within this budget, they stay as healthy as possible. Private insurance firms are incentivized to actually keep their patients healthy. So this is the market that a company we recently invested in, with Google, with Sequoia, with other large, with Fidelity, a large investor in a company called Clover Health. So they are in the Medicare Advantage space, which is a capitated market. The government pays annually for a patient to be taken care of. And the insurance firm will use all the methods they can to keep you as healthy as possible so you can minimize the cost. At Clover Health, we actually encourage patients to go to the doctor. They actually pay for some of their patients' Uber to go to the hospitals, because sometimes the patient thinks, hey, if I have to get my niece or my nephew to drive me, it's such a pain, I might as well not go. And they delay a year after year after year, and their disease gets worse. It's a $20 thing that insurance firm could pay that could save them $10,000, $20,000, from prevented hospital admission. And hospitalization is the most expensive part of the healthcare system.
Olivier, coming out of the World Economic Forum, what's the single best idea that gets to this alignment of patients and providers?
We need to work on a solution that allows a person not only to own their data, their medical data, but also to be able to have this data read by any medical facility they would visit. And that goes against some of the market, because there are huge amounts of money that are at stake when it comes to medical health records. And at the moment, one of the key issues is to be able to find the mechanisms, I would say, that would allow you to have a C3PO in your pocket.
A
Meaning
C3PO?
A
Now we're going Star Wars.
I mean, the fact
We
that
get
you
one
would
in our
have a
bed with her thing,
universal
or
translator, that wherever you go on Earth, in the US, in France, you would come with your mobile device, and your data will be in it, and any physician would be able to use it. But here's the problem. Who will pay for that?
Yeah, exactly, who will pay for it. All right, when we come back, we've got the lightning round plus good karma, bad karma. Where does our panel weigh in?
57.5%. The number may be unfamiliar, but the story it tells is not. This is the average high school graduation rate in the Bronx over the last half decade, 20% below New York State, 30% below the rest of the country. But why? Bad kids, lazy teachers, absent parents, underfunded schools? How about none of the above? What if the real reasons are a lot more complex than that? What if I showed you that the fact that there's only a dozen Starbucks in the Bronx, combined with the fact that the Bronx has one of the highest concentrations of trucking routes in all of the country, was more causal to graduation failure than any of the usual narrative? If you're intrigued, then follow me, and welcome to One Number.
Welcome back to Working Capital. I'm Adam Johnson, and guys, it's time to have a little bit of fun. We've been serious, and now we're going to lighten it up with the lightning round. You ready?
Yes.
So real simple. I'm just going to ask you a couple of questions, and I want you to respond in 10 or 15 seconds. I know that's not easier for you with your 3 college degrees, but we're going to get through this. All right?
Thanks, Adam.
All right. Appreciate it. Okay, here you go. Olivier, what is the number one thing that providers, hospitals and doctors can do to leverage data?
Well, they should talk to each other. They should work hand in hand. They should learn from the pharma industry, believe it or not.
Really?
The pharma industry has been working on consortium on vaccine innovation that was led by the World Economic Forum. A lot of people thought it was not possible. But I think that this kind of consortium is the way to go.
Alexandra?
Definitely talk to each other, use technology. So leverage software, leverage machine learning to actually learn from what everyone else is gathering from the patients. I think that will be critical.
So
for
make big
cooperation.
data bigger.
Yes, or more useful. Instead of
Yeah.
bigger, just make it useful.
Make sense of data.
Yeah.
And how would we make sense of it?
Empathy.
Really?
Yes.
How so?
I think you need people in charge, entrepreneurs and investors who are thinking from the end user's point of view. Without that, no matter how much data you have, it's just garbage in, garbage out.
All right, thank you. Question number 2, where's the investment opportunity here?
I think the biggest investment opportunity of our generation is the fact that the whole world is aging. If you do not count Africa, every single country in the world is aging. So healthcare is going to get more expensive because we're going to live longer, which is great for everybody. But we need to find ways to actually reduce cost and make sure that everyone can live a good life.
All right, Alexandra?
I was going to say the same, longevity. Anything that is going to take care of us as we age. Millennials are going to live on average 30 years more than the baby boomer generation. What are we going to do with those 30 years? Are we going to retire later on in life?
I hope not. That sounds boring.
That would be boring, right? Like
Yeah.
other 30 years retired. But so
Yeah,
that
right.
means that the whole system has to change. And technology is going to be a huge part of it.
You left the public sector to go private, so you're all about finding the investment.
Yes, it's not only that. It's also trying to understand everyone, not just
Empathy.
the Western and the European data that you can have in brain science, for example. 80% of the data that we have on brain research comes from the US and Western Europe. This is impossible for us to better understand, better serve many countries these days that have no access to brain health. Because when you look at developing country, they have lots of foundations that are helping for pandemics, for example, but no one thinks about the impact of brain health.
By the way, you're getting to my question number 3. Who has the better system, France or the US? They're single payer, we're kind of half, right, with Medicare and Medicaid.
It depends who you are
What
in
your
the
politics
system.
are?
No, it depends who you are on the system. If you're a person, if you're a user of a system, if you benefit from it, I would say France, because whatever happens to you, you'll be covered.
Right, just show up. You can't get fired in France.
Oh my, don't get me started on that. Come on.
You
I
came
gave
to
up.
the US,
I gave up
so
a
you're an
lifetime
entrepreneur.
job as a professor in academia in order to move
Because
to
you're
the
an
private
entrepreneur
sector.
and you want to make some money. And you have
Because-
ideas and you want to change the world.
And because I met Tan Lee, who's the founder of EMOTIV, and she convinced me.
All right. Alexandra?
Well, I have no experience with the French system, so I would say the US. I do think that we were talking about the whole innovation aspect
Right.
that's happening here. So there's an opportunity. I think that the way that the market is built here, even though it's not perfect, it opens up the door for many companies to enter the space.
Do you
and
think the
actually-
U.S. Innovates better than other countries that you have dealt with?
Yes. Yes. I grew up
Why?
in Mexico, so our system is more similar to France. You work, you're an employer doesn't have to pay that much for your healthcare. You just go to the hospital and you get any service, and you see the difference. The quality is going to be different because innovation is happening on this side of the border.
Yeah, it cuts both ways, doesn't it? France or the U.S., Hendrick?
U.S. I think the U.S. is very messy, but innovation is very messy. You're going to see a lot of failure. There's going to be a lot of pain, I think, with the healthcare system. But the U.S., because of the market forces driving, especially with capitation, the U.S. is innovating, and it's the foremost actually innovator. The whole world is reaching out to our companies to figure out how they can fix their healthcare system. Think about that.
All right, I want to tee you up to give us a little commercial here because we've given a lot of time to the bed sensors and the head sensors, but we haven't talked about Clover Health, or we just touched on it. Give me the pitch. Pretend I'm an investor and you want money from me.
Well, 65 and older, Medicare Advantage is around a $380 billion market. It's one of the most important issues in our lifetime because the U.S. is aging like the rest of the world. If we don't solve this problem, it's not going to be 18% of GDP as we have now. It's going to be 50 or 60% of our GDP as we take care of, as we should as a society take care of our elderlies. So Clover Health is using AI and is using data to solve this problem. And we're seeing real results. We have 30% reduction in hospital admission rate among our patients. Our patients are healthier, they're taking their medications on time.
30% reduction in admissions.
Hospital admission, yes.
Now you're talking my language. Now we're actually talking about cutting costs.
Yes.
Oh, I love it. All right, we're going to have to talk more about this. We're going to take a quick break, and then we're going to actually come back and try to wrap all this together. Final thoughts and moving forward together.
At a Glance spotlights smart ways to really live the good life. I deconstruct the latest trends and discover those brands who are doing well and really doing good, so that you, the consumer, can align yourself with purpose-driven companies who are committed to shaping our world into a better place. As the host, I highlight those companies who have turned doing good into good business and ask, what is their bigger purpose other than solely making profit? We are on scene, we're live, and you get to be part of the conversation.
Welcome back to Working Capital. I'm Adam Johnson. And right before we took our last break, you said something about cutting insurance costs 30%. You've got 30 seconds to explain that.
I didn't say cost, we cut down hospitalization. So hospitalization is one of the most expensive part of insurance. And like you say, most of the cost could be prevented because hospitalization usually deals with complication. If a person can make sure that their diabetes, their long-term heart disease, and their lung diseases are taken care of, they never have to go to the hospital. The insurance firms will love that. The hospitals may not like it as much, but we have the technology to do that right now. We just need to make sure that the incentives are aligned. We just make sure we have the right technology to actually find out who needs what. And that's where the AI and data comes in.
Understood. All right. So questions, we kind of wrap things up. We've talked a lot about, obviously, the three companies that you're a part of. Who else do you like? I'm looking for best in breed, and this is for the benefit of our viewers. What are some of the other companies you like? Companies that are doing it right that we may be able to invest in ourselves. Alexandra, do you want to start?
Yes, I love what 23andMe is doing because we see a parallel with what we do with sleep data and what they're doing with that genetic data. There's a lot of power in it.
They haven't gone public.
No.
Is there a public company you like?
Not that I can think of the top of my head. Most of the companies we spend our time with are companies in Silicon Valley, right? Small startups or medium-sized companies.
That's where the growth and innovation
Yes.
is. Yeah, it's all private. Olivier.
I like Proteus Digital Health.
Proteus Digital Health.
Yeah, they are putting trackers in your pills. So ingestible trackers so that you better understand the effects of a drug, the patterns that people adopt, their behavior, etc.
And when that goes into your body, it stays there for how long?
Well, it stays for a little while and then you get rid of it.
Of course. Okay, Hendrick?
I like all my portfolio companies.
Of course
so
you do. By the way, how many are there?
We have around 15 at this point, major positions. But I think if it comes to public company, the guys who are really innovating right now, you know, we like what the guys at Google are doing, so Alphabet. We like what the people at Alibaba are doing in Ali Health. They actually have their own healthcare now subsidiary that's doing very well. Alibaba is especially interesting because they spend a lot of time doing consumer logistics. You might know they help people deliver goods from factories to consumers. Now they're also helping drug companies deliver drugs from the drug company to consumers and payment and supply chain all the way through. So they actually have a database of where every single drug is going to in China.
And by the way, real quickly, is there a moonshot? Do you have a favorite moonshot?
Right now, most of the moonshots I think about are actually in the context of Clover Health. So Clover is already solving a lot of these problems that are seemingly mundane, but we're doing a lot more with data that we're tracking. I can't really talk about it right now, but there's some things that you'll hear about in the next few years coming
All
out
right,
of Clover.
I want to say thank you and goodbye, but just one final word. Everything that we've said, wrap it up for us in 3 words or less.
Data and empathy.
Data and empathy. Alexandra?
Connect the data.
Connect the data.
Brain health for all.
Brain health for all. I like it. And as you've all made clear, behavior is certainly a part of that. Guys, thank you so much.
Thank you.
What a
Thank
thoughtful
you.
conversation. The good news is we'll be back. There is another working capital, and we're going to be looking at Bitcoin. And why does it keep going higher? How's it actually changing the world? And how's it actually affecting the way that we all may invest and communicate one day? So that's working capital. Make sure you also follow us on Twitter, on Facebook, and tell us what you think. We want to hear from you. We might even decide to incorporate some of what you tell us into our next episode. So, team, thank you so much.
Thank you.
Hendrick, Alexandra, and Olivier. And all of you, we'll see you again soon on Working Capital.